All right, and here we are, 15 people already. Look at you guys, you're so prompt. I'm so impressed. It's Monday, Motivational Monday, right? Aren't Mondays Motivational Mondays? We have people saying hi. Hey, Barb Zaz, you ordered the book over the weekend? Yay! Tammy Lewis, happy Monday. Beth, hey, Beth, how you doing? All right, so we've got then Christy Newberg-Getch coming off a sunny Mother's Day. Oh, to a dreary morning in Battleground, Washington. But it was Mother's Day yesterday, and I imagine a few people did what we did, which was getting together, really social distancing, but at least they were in the near vicinity, right? This is May 11th, Monday, and it is always Motivational Monday. So we're going to motivate this week to do a few different things with our health. But first, I have exciting news for you. I'm not doing a regular Facebook Live today. I'm using something called StreamYard, and you're going to see, as long as it works, you're going to see my interviewee, Dr. Ruth Oratz, today, right up here on the screen with me. And just in case, I've got her up on my phone to hit, but I expect it to work. So you guys, this is National Women's Health Week, and this is something that is run by the Department of Health and Human Services, and I work with them every year. I've been their spokesperson for the last 4 or 5 years, but it's really to make sure that we're all disseminating really important health information and reminding everyone to make sure that they have all their annual screenings. So I know that some of you have told me that you've had medical appointments like mammograms and things canceled during this pandemic. We just all have to remember that don't just like take them off your calendar, like put them on June 1st or something. And so you'll be reminded to call back, get them rescheduled. It was 6 years ago. It's coming up on the anniversary on June 5th, 2014. I was diagnosed with stage 2 triple negative breast cancer. And I really learned at that time the importance of being able to call on medical professionals and to put together that team and get the right, diagnosis and the right treatment plan in place so that I could save my life. I mean, literally. One of the wonderful, wonderful people that I turned to was oncologist, Dr. Ruth Oratz. And she is not only an oncologist at NYU Langone, she is also a clinical professor in the Department of Medicine at the NYU Grossman School of Medicine. And Dr. Oratz had just come back from ASCO. That's this big, huge breast cancer convention that happens every year in Chicago. And she had listened to a whole discussion about a brand new way of treating breast cancer, particularly my kind of breast cancer. And I got a second opinion, like, they all tell us to do, which was definitely not the same opinion. But she helped me to understand why I might want to go with that new approach instead of this, what they call standard of care. And I am certainly glad that I chose to listen to her and beat my cancer. And here I am almost 6 years later, cancer-free. And I'm excited also to share her with you today. So let's see how this new system works, okay? All right, add to stream. And here we go. Hi, how are you, Dr. Oratz?
Great to be with you today.
Almost 6 years
since
that call to you.
Yes.
And at that time, I didn't know what I was going to do. And I'm so incredibly thankful that I had you guiding me. COVID or not, women are still being diagnosed. I mean, it's a startling statistic how, I don't know, every 8 seconds in this country, women are still being diagnosed with breast cancer and still have to go undergo treatment. How is that happening?
Well, all through this, we have been able to take good care of our patients. For women who've been diagnosed with breast cancer, we've had to make some adjustments in the treatment. And in some cases, we started with medical treatment first, chemotherapy or hormonal therapy as a bridge to surgery because some of the ORs were closed. But now, as we're able to open up our ORs and the hospital is restaffing, I think we'll be returning to our normal flow of surgery and then treatment for most of our patients.
It's interesting because that's what you had me do. I started with all my chemotherapy first because you wanted to be able to see how the breast cancer reacted to that. And for me, most importantly, it meant that we almost eradicated both tumors, and I had a very small lumpectomy instead of having a very big surgery, which likely would have required breast augmentation.
That's right. That's right. So we really are seeing that we can adapt to the situation, not only based on the type of cancer that each woman has, but this was such an unexpected event that happened to our healthcare system that we've really been able to take what we've learned from research studies and transform how we're treating people during this. And
one of the things they always talk about is a suppressed immune system. So are you doing different proportions of chemo and not like blasting them out?
We have had to make some of those adjustments, whether it's in the dosage or the spacing out of each cycle. So instead of compressing cycles, maybe a little more time in between each dosage. But by and large, I think we really have been able to treat people with appropriate, effective therapy, making those adjustments to keep them safe during this time when they could be exposed to serious infection.
And what if a woman has felt a lump or something? Have they been able to come in? Have you also been able to do mammograms there and ultrasounds?
Yes. I mean, some of this, I'm moving my computer around to try to get my...
You look great. There you go.
Okay. Yes, we have been able to do diagnostic imaging, biopsies, and make a diagnosis for a woman who has a problem, and then to initiate therapy. Yeah.
But a lot of the smaller radiology labs, even like Right Radiology, that where I went, where they found my cancer, we're going to be talking to a radiologist from there, Dr. Diane LaRusso, on Thursday. They've been closed, and they just only opened up in the last few days for urgent care. They hope to be opening up for regular mammograms. But I've heard from women who were really concerned when all of a sudden they realized that their annual checkup has been canceled.
Yeah, that's absolutely
women do, and especially if they feel something that just doesn't feel right.
Yeah, you're absolutely right, Joan. And even we at the big medical center had to postpone a lot of our routine screening for people who don't have a history of breast cancer or a problem. But we're now starting to open up, and I think that women should contact their physicians and the mammography place, the radiology center where they go for screening, because those screening tests are going to be rescheduled, and people will be able to go in to have their annual mammogram or whatever testing they need over the next several weeks. We're starting to open up slowly for those routine screening tests.
You'll try to pick up all those people that got canceled, because right now, Ruth, women are just they've got their kids at home. They're still trying to work, many of them. Their lives are crazy. And we know, we've talked about it, how easy it is for a woman to kind of get bumped off her to-do list. And before you know it, it's like, oh my gosh, it's been a year, I haven't had my screening.
Right. Don't put that mammogram on the back burner. Just make sure that you get it on your calendar. Even if it's 8 weeks late or 12 weeks late, get it on the calendar. And I think certainly by June, July, August, this summer, all of our screening facilities should be back up and running. We may have to space things out, and we're going to see some changes in what people can expect when they come into a medical.
Yeah, let's talk about those, because it's going to look different, right?
It's really going to look different. I think one thing we're doing is spacing out appointments. We want to have fewer people congregating in waiting areas and so on. Maybe limiting visitors or guests who come along with you. So come by yourself. And a lot of places are doing screening. This is going to vary based on where you are in the country and around the world, but someone might call the day before and make sure that you haven't had a fever or a cough or symptoms that might mean you've been sick or are sick. When you get to the facility, they may take your temperature, they may not. And we are asking, at least in the New York area, that everybody wear a face covering or a mask when they come into the facility. And of course, the providers will also be wearing masks. So that's going to look a little bit different. But
yeah, I know that
we're there for you.
Yeah, you're going to be in there. I know that, like at Rye Radiology, they're going to have you stay in your car. That's the difference, of course. You're in New York City. You're going to stay in your car. They're going to text you or call you, and then you will have your mask on. You'll walk in. They're not letting anybody even stay in a waiting room. So it'll probably be different in different states, I imagine.
I think so, but I really think medical centers and facilities are going to be super careful about this.
And I venture to say, do you think that this is going to be maybe the new norm going forward in medical offices? I mean, until this thing somehow is totally eradicated, if that ever even happens?
I think certainly for the next several months and even up to a year from now, we're going to have to be very careful about maintaining social distance, wearing face coverings in a lot of places, certainly hand washing, which we always do. But yeah, we're going to see this for a long time to come. But that doesn't mean we can't stay close to one another and have close relationships, even if we have to keep a few more inches in between us.
Now, I should point out that you've been doing, I mean, telemedicine. I mean, that's been what's kind of coming down the pike for a long time. And now all of a sudden, this pandemic just made it click into gear instantly. And you've been doing most all your appointments telemedicine. But tell us how you've really been able to still let women even show you what's worrying them, right?
Right. Well, of course, we have been in the medical center for women who have to come in for their chemotherapy. So we have been there in person, but the rest of the visits for the last 2 months have been on this telemedicine video visit. And it's a great way to check in with people. I can see my patient, we can chat, I know she's feeling okay. We can talk privately on a secure line, so it's not Facebook or something like that. It's it is a secure medical secure line. And I actually have some patients, where I said, okay, lift up your blouse, let me see what's going on, or show me that area you're concerned about. And we can do a lot with that. So the video visits have been really, really helpful. I can coordinate tests that need to be done and order medications and make sure that people really are okay at home. And it's been a real game changer for us.
Yeah, we have different people talking to us right now saying that they're going to be having to wait in their car and calling in to the office. We're also waiting for our car. Marilyn Safiano says to go into the doctor's appointment here in North Alabama.
Right.
Janice Mark says, superhero Ruth. And I see several other people just, kind of singing your praises. Simone Joseph, Dr. Oratz is the best ever. And so it just so happens that you are married to another doctor who is also one of my doctors, Dr. Albert Knapp. He is a gastroenterologist.
Right.
And his offices have been closed, right, until just like now?
So they've been closed really for all of
the whole time.
The last reopening now, again, following the guidelines very safely, a little bit at a time, really for patients who need to be seen because of problems that are ongoing. We're hoping that soon, in the next few weeks, we'll be able to start doing routine screening colonoscopies and endoscopies. Right now, procedures are only for patients who need diagnostic tests. Again, this is going to vary around the country as we see the different guidelines about what's going on. But colon cancer is preventable if we screen and catch it early. So
that's what I was just going to say. Kind of like mammograms, right?
Right.
You know now that if you
gotta go.
Yeah, if you catch, breast cancer at an early stage, you're like 95% of women will be able to survive it. Yeah. So we have to depend on getting in, and the same for a colonoscopy. Everyone, if you had yours canceled over this time, or if you just haven't done it, whatever you do, make sure you get those screenings, and your doctors will tell you how often you have to have them.
Right.
So the bottom line here is, if you've had an appointment canceled, whatever you do, you want to reschedule that appointment and just call the office.
Yes, absolutely. And get back on the schedule, and don't, put yourself last on the list of things to take care of. Because if you're not healthy, You can't take care of all those other people around you who depend on you.
It's such a woman thing. For right now, what is the best advice for people staying at home right now? Like all they're thinking about is the COVID. In the meantime, like all kinds of other things can happen to our body. What's your, as a doctor, your best advice for everyone listening right now?
I think for every day, the best thing is stick to your normal routine. Try to get up at the same time that you normally do. Go to bed at the same time you normally do. If you're working from home, get dressed. Don't just sit around in your PJs.
Because it changes your frame of mind, right?
It really does. And it's important and it's good for your head. Try to exercise on a regular schedule. I mean, I miss my yoga class. I miss my Pilates teacher, but I found some great online classes. And
there are a lot.
Click in, and I try to do it on the same schedule of when I normally would have been doing those things. If you get outside for a walk, fresh air and sunshine is great, or any kind of outdoor activity. So try to stay physically active. And the other thing is, we're all cooking. So we have control.
Oh, we are, aren't we?
So we really, really have control over what we're eating. Keep it clean, keep it healthy, keep it lean. A couple cookies here and there are fine. But yeah, I think,
Did you do a little baking?
A little bit.
But that just goes to show you that you also have to let yourself have, something yummy now and then. Everybody has their own thing. For me, it's Tostitos.
I go for the chocolate chip cookies.
You're either the sweets eater or the crunchy eater, right?
Yeah.
All right. So, but you expect things to be opening up. I guess it goes state by state, but even here in New York, where they're somewhat reluctant to open things in the tri-state area, doctors' offices are going to start opening?
Yes, doctors' offices for sure, and more services at the medical centers and at the clinics, more and more. I mean, we are essential, right? We need to get your health and your maintenance done. So, and we're even seeing in our hospitals that a lot of what was completely consumed by COVID is going down, so patients are coming in for all kinds of their regular checkups and so on.
And that means more operating rooms will be open so that you can schedule more of your surgeries, correct?
Yes. Our surgeries are going forward, treatment is going forward, and I think that you can feel safe coming to your doctor's office.
I have somebody here, Janice Marks, who says, oh, you should ask Ruth about her baking.
I just let you know that Janice is also a great doctor. She's out in Colorado now, and an old friend. So I have been doing a lot of baking during this, yes.
So here's Stephanie Mikado, who says, I had my checkup virtually last week. It went surprisingly well. I'm a triple negative breast cancer survivor, almost 5 years, and thought I felt a lump in my good breast. Based on the doctor reviewing the films, it is only scar tissue. My compliments to all the doctors having these virtual checkups and helping us to feel comfortable.
Well, that's what we're here for, and that's great news that everything worked out for you, Stephanie.
All right, doctor, it's great to see you. Don't worry, I'm going to all of my annual checkups. I've been, of course, on 6 months now that I'm almost 6 years out. They're spacing out a little bit farther. I'm getting back to normal.
Yes.
All right, thank you, and
virtual hug.
And hi to your wonderful husband, my other doctor. All right, so we're going to say goodbye. And then I'm here. Check that out. I like my new system. It's working. So listen, you guys, tomorrow, as we continue on with National Women's Health Week, we are going to have, I'm so excited for this interview. It's with an ICU trauma nurse. Her name is Jackie Baldo. She's only 28 years old, has 2 young children. She is a trauma nurse taking care of the sickest of the COVID patients at Westchester Medical Center here in the surrounding New York area. And then she, at the end of every day, and they do 12-hour shifts, she has to go home, and wait till you hear what she has to go through, changing clothes and then showering, changing clothes again, just to be able to go in to her husband and her little children and still be safe with them. On Wednesday, we're going to have Megan Murphy here. She's such a firecracker of an individual. She has been with one magazine after the other, Vogue and Redbook. Now she is the brand new Chief Content Officer of Woman's Day magazine. If you've been in the grocery stores, you may have seen the magazine on the stand. It's got a pink front. Do we have it right here? It has a pink front. I have it right there in that, and it's their Strong Woman issue. And so they had me interview all of these different women, that were from totally different professions. This is the one, you can look for it. And it's their Strong Woman issue. And so I participated in that, and we're going to talk about not all these health things, but all the other things that also matter: resilience, perseverance, your attitude, being able to manage stress. Then on Thursday, I'm going to have with me Dr. Diane LaRusso. She was the founder of Rye Radiology, and that's where my breast cancer was found. And we'll talk about mammograms and ultrasounds and dense breast tissue, which also really puts you at risk. And then on Friday, an incredible woman, Dr. Judy Garber. She is with the Dana-Farber Institute in Boston, but she is also the chairman of the advisory board for BCRF, the Breast Cancer Research Foundation, because all of these doctors and everyone that's taking care of us, they wouldn't be able to treat us if they didn't have the treatments. So we're going to talk about all of the researchers and scientists around the world, and BCRF gives $66 million to these just this year. And a big chunk of it this year, really half of it, $33 million is going to go to metastatic breast cancer. And that's such good news, because we need to be able to figure out a way to make breast cancer a manageable chronic illness. I mean, they were able to do it for HIV, and they're really trying to figure out a way so that we keep women alive. All right, look at this. I'm actually ending when I'm supposed to end. All right, everybody, go out, have a great day. And remember, it's National Women's Health Week. So if you haven't been tending to your own health, this is my little gentle little kick in the tushy. Okay, see you tomorrow. Bye-bye. End broadcast.